I don't know the answer to that. I know there has been some concerns expressed to us from some religious leaders about what's the right word? Nasty messages that people are hacking into Zoom meetings, which I think is really deplorable. I have not heard concerns about anything in the education or certainly not the healthcare realm, and I'm not sure that Zoom is what is widely used for the virtual care. There are many platforms that can be more secure than that.
I think, Marcella, there's more virtual healthcare going on right now than we've ever seen in the history of British Columbia, and I don't believe that's the platform that it's being carried out on. And there's many platforms that are working very well with family practice doctors and patients. And the whole idea, I think, of the Zoom as we envision anyway, with many people participating, is not the idea of primary care medicine, which is to have private exchange and provide private advice. But I think a reasonable person would say that we're using more virtual care than we ever have before by a factor of several times, and that this is going to have important long-term implications because for many people it's succeeding. And I'll just note the numbers that Dr. Henry talked about today, the number of people who have recovered from COVID-19 at home with the daily support of public health and with the support of primary care doctors and nurse practitioners around BC, which indicates that those practices are working for people, whether they're telephone consultations or some form of video conferencing or virtual care. They're still they're working for people. So I realize there's been some complaints about Zoom as a technology and some concerns about it in education, and maybe others are way more qualified than I to speak to that. But in terms of virtual care, I think we're seeing some success, and I think we're going to take the learnings of this success forward, hopefully after we've got through dealing with this pandemic.